Namaste. I am Dr. P. Nagendra Babu, consultant homeopathic physician at Sri Mahima Multi-Specialty Homeo Clinics, Anantapur and Bangalore. And I also work as assistant professor at Rosie Royal Homeopathic Medical College in Bangalore. Welcome to this presentation on the homeopathic medical approach to fight the pandemic of COVID-19. Along with the whole world, India has also become the victim of COVID-19. Before we proceed with this presentation, let us have a quick recap of the story so far. To start with, lockdown has been decided for the benefit of the mankind. In the present situation, should lockdown be continued or stopped? What will be the advantages and disadvantages? If it is continued or stopped, WHO has said that lockdown is to equip ourselves to fight and postpone the impending danger or pass to limit transmission, to prepare the health setup, testing kits, ICUs, highly sanitized environments, to reduce death rate, to prevent piling up of cases, to reduce the morbidity rate, to give us a pass, a warning for the precautions for us to be taken, to alert the people, to alert the government to take necessary precautions. But after lockdown, what? What if the cases rise? Lockdown for how long? What about the attendant consequences, other health problems, mental health challenges, economic fallout? So, then what? Next comes a thought of developing herd immunity to COVID 19. Herd immunity is developed by exposing the population to the virus and let fate decide of how much time would it take for the whole population to gain herd immunity. Many questions arise. Cases will rise, deaths will increase, except that a few more people may gain immunity against it. But it is with risk. Those who have immunity will fight the disease or may not be affected, but otherwise the rest may die. So then, how do we live the lockdown? Next thought is staggered exit lockdown method. Staggered exit from lockdown method may be helpful at this moment. An exit strategy is needed for a smooth end to the lockdown period, meaning staggered re-emergence of the population once the lockdown ends. It means wherever the cases are less, those areas must be released in a staggered method, while we continue giving importance to social distancing and maintaining all the precautionary measures. Aggressive testing is the only way to contain COVID-19, meaning identify, isolate, and treat slash quarantine. In epidemics and pandemics, the first step is to keep doing aggressive testing to control a pandemic. Classifying into red zones, orange zones, and green zones will help in reducing the transmission of the disease. We all have to work together to convert red zones into orange and green zones. Classify commodities essential, semi essential, non essential based on population needs. Completely shut down non essential ones until the virus is contained. Constant monitoring will help us to contain the virus transmission. All the measures that are being followed help only in containing the virus to some extent. Orange and green zones to be under vigilance. Avoid mass crowding, only essential goods made available. Possibility of acquiring herd immunity in these zones is high. Also, these zones can help to keep the economy going. Lockdown is not the solution for curing or prevention of the disease. So, now if the lockdown continues, nation's economy will fall with associated consequences. What about the treatment? Where are we? Ongoing global efforts to find a way to prevent or cure COVID-19 for various drug and vaccine trials, plasma-derived therapies. Vaccines would take a long time, from months to decades, to develop, and the guarantee can't be assured without risk. So the tests have to be conducted for efficacy and safety with massive investment in thousands or millions of rupees and dollars, research facilities, laboratories, equipment, etc., and can't be for the whole world in short time. There have been already 4 coronaviruses identified and are already circulating in human beings, causing common cold symptoms and no known vaccines found yet. Viruses keep returning again, posing constant threat to the mankind. There are chances of viruses to attain genetic mutation at any period of time, leaving us with a question mark again how to deal with it. Newer modes of transmission can occur. Treating viruses as such has always been a challenge for the medical world until now. Till date, results have been inconclusive. Meanwhile, people continue to get infected or die.
Hi, I'm Dr. P. Premajyoti Fraser, consultant homeopathic physician at Sri Mahima Multispeciality Homeo Clinics, Anantapur and Bangalore. I am also a teaching faculty at Bhagwan Buddha Homeopathic Medical College, Bangalore. I will now continue with this presentation. In this context, let me explain briefly about homeopathy as a medical science.
Now, the whole world is searching for a proper treatment, and all the medical community is experimenting to treat this world's new disease, that is COVID 19. As of now, there is no clue of how to treat. As a homeopathic doctor, it is my duty to educate you about the merits of the homeopathic medical system. Worldwide, over 200 million people use homeopathy on a regular basis. India leads in terms of number of people using homeopathy, with 100 million people depending solely on homeopathy for their medical care. The Central Council for Research in Homeopathy (CCRH) in India, under the Ministry of Ayush, Government of India, undertakes evidence-based research in homeopathy so that its benefits reach the larger public. The principles of homeopathy are based on sound logic and experimental data generated by the founder of homeopathy himself, Dr. Christian Frederick Samuel Hahnemann, in the 18th century, as well as by various national and international centers of excellence. The principles of homeopathy have been challenged on the grounds that nothing can exist beyond Avogadro's constant. However, today homeopathy is recognized as nanomedicine. Now, let us discuss about homeopathy for the prevention and cure for COVID-19. Homeopathic approach is required now more than ever in the face of this global crisis of COVID-19. Homeopathy offers a solution for the prevention and cure of COVID-19. Yet, treatment with homeopathy has been met with doubts raised over its effectiveness, safety, lack of scientific evidence, etc. Standards of efficacy or scientific evidence of homeopathy cannot be established or judged according to the standards of other systems of medicine or by others' knowledge or opinion. Homeopathy has its own principles and is a standard by itself. In order to comment on homeopathy, one needs to understand it and experience it. Countless benefited patients speak to its effectiveness and scientific evidence. See our video on the concepts and principles of homeopathy in the link provided. Science does not mean only things brought out on paper. Good clinical outcomes are the best scientific evidence. Example, symptom relief, improved functioning, well-being, and overall quality of life. Homeopathy is a symptomatic based treatment. It is individualistic in approach. Now, people may express their doubt that each one may have a different medicine. The hydroxychloroquine that has worked in India has not worked in a few other countries. Also, Additional symptoms have been observed in certain people. Now, these are called the variations. This can be understood by following the news of corona. In homeopathy, these variations are considered naturally and treated, and we consider it as an individualistic approach in curative level. In preventive mode, we have certain basic principles basing on the area, environment, the symptoms experienced in that particular group, etc., and many other factors to select a medicine. That is why we find a group of remedies coming up basing on those variations. So this is individualization. In the same way, keeping the environmental factors and symptom similarity in our areas, etc., ourselves is given as an immune booster for COVID-19 as advised by Ayush Ministry. For certain other symptom groups selected basing on the variations experienced in communities, the following remedies are also suitable, like bryonia, influenzinum, camphor, phosphorus, zincamure, causticum, echinacea, gelsemium, crotalus hor, etc. But for curative purposes, medicines must be given strictly under the supervision of a qualified homeopath. This individualistic approach ensures that the desired effect is achieved, including for COVID-19, which gives a complete symptom relief and complete restoration to well-being and immunomodulation. Take-home message for us. The need of the hour is to fight the COVID-19 with an integrated approach. Homeopathy can fight it. The Ayush approaches to treat and to boost the immunity along with the government-initiated measures such as identification, testing, isolation and quarantine has to be followed to contain the virus. Other general measures has to be followed like social distancing, hygiene, etc. to reduce the rates of transmission of the disease. Homeopathic treatment to fight COVID-19 is not a futuristic thing. It already exists. Its effectiveness has already been proved in earlier epidemics like dengue, chikungunya, Japanese encephalitis, swine flu, brain fever, etc. Homeopathic principle itself is symptom-based. The medicines are prescribed basing on the symptom similarity of the disease and the symptom similarity of the person having the disease, and thus it can treat this pandemic effectively. Distribution of homeopathic medicines at every zone and treatment centers will help to prevent and treat and thus speed up the process of improving the immunity faster. Homeopathic medicines to fight COVID-19 in both the preventive and curative aspect are effective and completely safe for everyone, including the newborns, the oldest of old, pregnant women, lactating mothers, and those with comorbid illnesses. Homeopathic treatment to fight COVID-19, both in preventive and curative aspect, does not need expensive investment or resources. It is very, very cost effective and can reach every person of all socio-economic status in our country until COVID-19 is contained. In the face of the COVID-19 crisis as well as these emerging concerns, valuable time is getting lost in speculations about the effectiveness and scientific evidence for homeopathy and other Ayush systems. This is resulting in the loss of thousands and thousands of lives to the virus and enormous economic turndown. Thus, homeopathic treatment is needed for everyone to restore normalcy and order to our lives. Let us use this system of medicine to join hands and fight the battle of COVID-19 and protect mankind.
We trust that the government will continue to support us and facilitate the effective implementation and use of homeopathic medicines to fight this battle. Thank you.